The reason why this is very important for realtors, of which I am one, just a little about me for a second. I do operate a insurance agency, financial planning, wealth management, estate planning administration firm for the last 35 years called Affinity Wealth. Some of you may know that already. Some of you are teammates of mine. But I do provide programs, marketing services that are related to prospecting for business, whether that business is insurance, financial matters, legacy planning, health and welfare, or real estate property sales. And the big thing to remember here is that you keep in mind that everything you're going to see, while to you it may seem like it's product generating a commission or an income, but this is really more meant to really help people. That is what it's all about. We have found that there's a gap missing in marketing in the real estate industry, and realtors really stay in their lane and just do transactions. But in order to really develop a book of business, retention, recruiting clients and retaining them, and then picking up leftover pieces of business that equate to income, we need to go out there and serve communities and show ourselves as more than just a real estate transaction professional. So please keep that in mind as we move along, that what you're going to hear and read today, while it will help people, think for yourselves how positioning this will help you. Let's talk about, and why you're here today, I think, is because you saw something that might have alluded to helping people stay at home and get home health care for a fraction of what it normally would cost. But why is it safer and better to be at home anyway? And what does this have to do with being a realtor, right? Well, obviously, the more times that you're in someone's home talking about them and their lifestyle, the more opportunities will surface regarding property and decision-making, whether or not they need to keep the property, downsize, modify the home. This will allow you to become that realtor of choice, the person that we like to call the family realtor or trusted advisor. So between 1980 and 2024, the centenarian population increased by a larger percentage than the total population did. There were approximately 101,000 people aged 100 and older in 2024. According to the US Census, more than triple the figure since 1980. I'll just stop here and say my mom is 101 and a half, and she's actually physically in better condition than I am, being close to 70. Mentally, she's sound and very strong. So people are living longer. This means that seniors will eventually require care in order to continue living at home. Most of your senior clients do not have any plan for this in place. Not only do they not have a plan, they don't have the money for it. And this is something that really should be introduced to the real estate industry, and you're in a great position to do that, because if they're spending money on healthcare, they're not going to be able to afford their $1,000 HOA payments any longer, are they? We'd like to make sure that we're doing things to help a family remain at home and avoid the high costs of nursing homes, assisted living facilities, community facilities. Creating a plan, though, should be as much a part of long-term planning as family trusts and wills are. Now, I do work in that space, and we have realtors here that are on our team that help create or facilitate coordinate estate planning. That puts us in a catbird seat, if you will, to understand deeply what's going on with that family. So we want to make sure that in our discussions, we're bringing up subjects that are important to them, not just, hey, that's a great bathroom, isn't it? Well, you wouldn't want to slip and fall in that bathroom. And if you do, you're going to want to make sure you have care. So there are many advantages associated with staying home, right? Seniors get to stay at home where they're secure and familiar with the people, their pets, and their environment. This is truly what people do want. Nobody wants to leave their house and go to a facility, right? Makes sense. Home care promotes companionship. That is important bond that people have, especially if there are young children involved or grandchildren. So you live your whole life, and then what? And then you're thrown out on the street, or you're thrown out into a community with strangers. Is that healthy? Evidence shows that people who heal at home tend to heal faster, and the people in a household will also learn how to take care of their loved one properly from their agency caregiver, which ultimately increases the quality of life for the entire family. Now, statistically, the number one reason that a senior will need home care assistance in the future will be because of a trip and fall accident in their home that can happen at any given day, at any given moment, and result in a broken hip, broken shoulder, broken leg, head injury. You get it, all of that stuff. You don't have to be an elderly to have this happen either. You can have a skiing accident. You can have a car accident that can cause you to require someone to stay home with you and take care of you. Do you really want your spouse or child to try to figure out how to lift you up and take care of you? What a terrible inconvenience that is emotionally, financially, physically upon them. Now, I don't want you to take just our word for this, that this is a very important subject and that there is a product and a service that you can take advantage of and be involved with. I want to introduce you to Dr. Marion Summers. She's probably one of the leading geriatric authorities for the aging and the elderly. I'm going to play a video here.
She's one of the country's foremost experts on caring for seniors.
Marion Summers, also known as Dr. Marion, is an expert in elder care.
We need some help here, so we called in the big guns today. Dr. Marion joins us.
NBC News In Depth tonight. We continue our special series, Trading Places, on taking care of aging parents. This week we're looking at your stories, and one of the things that has come up in the well over 5,000 emails and pictures we've received on this topic, the issue of long-term care insurance.
Yearly premiums can run you anywhere from around $1,000 to several $1,000s, depending on your age and the options you choose. Dr. Marion Summers is a geriatric care manager in New York.
And with us is Marion Summers, whose PhD is in human and organizational development with a specialization in retirement. And she's also the author of Elder Care Made Easier. Hello to you.
Thank you. Hello, I'm Dr. Marion. I've been in elder care for over 40 years, and elder care is my passion. I've traveled the country many times on bus tours, and I have gone from the state of Washington to Washington, D.C. And the tours are all about educating and alerting America about long-term care. Remember, a failure to plan is a plan to fail. On my journeys, I have met people and been introduced to products and services, and there are some services out there that have not gotten the attention they deserve. Specifically, I'd like to bring to your attention a product called True Freedom. This is a product from American Senior Services Incorporated, also called ASSI. I have firsthand knowledge of this product. ASSI has been in business since 2008, and they are a viable alternative to traditional home care services. ASSI only uses bonded, insured, and licensed providers, unless the client chooses to use the friend or neighbor plan. The True Freedom product offers companion services and home care services such as meal preparation and laundry, assistance with dressing, bathing, and toileting, personal hygiene, and even accompany someone to the doctor. ASSI's response time is very quick, 24 to 72 hours. Now let me tell you what makes the True Freedom product unique. There's zero underwriting, zero age limitation, and no prior hospitalization is required. I strongly urge you to take a look at this product when you are formulating your long-term care plan. It could be additional protection to work in coordination with your long-term care insurance. Remember, when looking into a company's profile, make sure that they have their credibility in order. For instance, when I reviewed American Senior Services Incorporated, they had the highest rating with Dun & Bradstreet, and they had an A rating with the Better Business Bureau. So check out American Senior Services Incorporated and their product, True Freedom.
Somebody said that, who said this here? Kim, yep, was in a nursing home, had a tragic accident there and died. So I don't know if you want me to read this or not, Kim, but you know, it's touching. And yes, you do not really want people to be in a facility. That's for sure. And the point is here, folks, as I said earlier, this is not something that we're doing to get you to say, hey, how can I, get out of the real estate business? This is really meant for you to understand how you can get more involved in selling real estate and selling this as well, and fill in some of these financial gaps that occur during the downtimes of real estate, which we're experiencing currently. There's many reasons to get involved in doing this. Now, we know that seniors are living longer than ever. We touched on that, like attention deficit, Alzheimer's disease. Leaving a loved one in this condition at home alone quickly becomes a life-changing reality that weighs heavily on an entire family. Now, securing the True Freedom nationwide home care plan today addresses this important discussion, and we'll talk about that, by already putting a strategy in place before any symptoms of a diagnosis is triggered. Now, let me say this. Many of you may have thought or saw $95 a month for in-home health care. That is the truth. However, it is $95 a month when you don't need health care, when you don't need an aid, and we need to go through that. So please, if you really thought that you would pick up $95 a month and immediately be able to supply this to someone who is paying for an aid and paying $4,000 a month or $3,000 a month, then this isn't for you. What this is for are for those people who get it and understand that future protection can mean more than waiting the last minute. So this is something similar to a AAA account, right? Where you pay for that instant that might occur that you need to call someone. You're not going to find a better, more reputable way to get this done. So planning ahead is hard for a senior. It always is. When I talk about estate planning or legacy planning or create a will or put a plan in place, everybody wants to delay that. So the trick is, how do you make it fun, right? How do you talk to people in a way that elicits communication response back from them that they can really grab and say, you really do care. This is not about you trying to sell me anything. I'm trying to sell them peace of mind, yes, but I also want to protect them and their family. And when this happens, their family truly will know who you are. Now, if having your own individual care provider helps you with your spouse or family with daily necessities like food preparation, grocery, bathing, dressing, and all of the general comforts to enjoy at home, if that's what somebody would like, then this program and product could definitely be the answer. Unfortunately, most of the time, a senior care plan, and there hardly are any care plans, and to try to find a care plan, you've got to call 800 numbers and make countless phone calls to try to figure out what to do when something happens. And people perform this knee-jerk reaction in response to an unfolding current crisis. That is what we're trying to avoid. In that environment, important choices are made quickly without clear or complete information and under their duress, which is not the time or circumstance to be making such critical decisions. This is why it's so imperative to have a plan in place, already in place, that will take care of that unexpected injury, illness, or diagnosis. You probably know, we've just heard from someone, right, who had tragedy strike. Today's family caregiver, though, is a 49-year-old on average woman who juggles a career, her own kids, and her household. She provides nearly 20 hours a week of unpaid care to her parents, doing this for almost 5 years. The emotional and financial stress providing this care puts a strain on her health, wellness, employment ability, income reduction, marital jeopardy, right? Familial problems, and on and on. And as more people are living well into their 90s or 100s now, people are running out of money. One of the biggest things that I do is help people, preventing them from running out of money in their life. So the US Census results show that the oldest old are the fastest growing segment of the population. Folks, if you want to market to seniors, if that intrigues you, because it is that baby boomer market and beyond, then you need to tap into, get educated on programs such as this that will allow you to get knowledge and insight to that family in a non-threatening way, a way that shows them you care about them. And if you care about them, they will provide you with their transaction and assistance for real estate. Consumer surveys reveal common misunderstandings about which programs pay for long-term care. I've heard this for decades. Oh, I'm not worried. Medicare will take care of me. Medicare will pay. Medicaid will pay. People don't even know what the difference is between the two. So we have to educate them on that. Medicare does not pay for any non-skilled assistance at home with activities of daily living. Those are called ADLs. It's a very common expression. And they also won't pay for any grocery shopping, food preparation, assistance with dressing them, bathing them, hygiene, grooming, taking them to doctor appointments, right? Taking them out, companionship, monitoring their diet, and food expirations, medication reminders, and much, much more. Medicare doesn't pay for any of that. A person has to pay out of pocket. And I don't know where you live, but I can tell you in Florida what it costs. I know what it costs in California. I'm in tune with statistics of what these costs are. And so it can be $2,000, $3,000, $4,000 in a month. Those without long-term care insurance, and I'll touch on that, often start out relying on an unpaid family caregiver. So what happens is a person gets sick, something happens, and then they have to call a family member, not pay that person, feel terrible about it, and eventually they need to turn to paid help. They realize that their family can no longer do it. Maybe they don't even realize it, but the family realizes it. And that could be extremely expensive. According to Genworth, one of the largest statisticians in this area, 2024 survey, The national average bill for a home care aide can run over $5,000 a month. Believe me or not. I think it's a crisis, says Jennifer Van der Veen, president of the National Academy of Elder Law Attorneys. Getting reliable home care is not as available and affordable as it should be. So there's a sandwich generation. You need to know what that means. These are people between the ages of 40 and 60 that are having to take care of elderly parents as well as still caring for their children and supporting themselves as well. It's a difficult time of life. So this role can create tremendous pressure financially as well as emotionally, as you can see. And if your clients or their parents are still living independently, well, then now is the time for that assistance to take place. 70% of seniors will most likely require care in the future. I had, in 2019, I had major surgery. I recovered in 2020, 21. I had dual hip replacements. Right after that, I had another major surgery. Right after that, I had another major surgery. I was fortunate that I was sort of young enough to get through it. And I had my wife here to help me. But that's my story. It may not be like that 10 years from now, even for me. Most older adults are divorced compared with previous generations. So I just mentioned, I had someone. If I didn't, it would be a different story. The share of divorced women ages 65 and older increased from 3% in 80 to 15% in 2023, and for men from 4 to 12% during that same period. The rise in divorce, single-parent families, and blended families that include children from previous relationships, they may lead to weaker family ties and less caregiving support for aging spouses and parents. Now, most home care is provided by a spouse, as I already said, and by their children, right? Their daughters more often than sons, and by other family members. With the baby boom generation having fewer children than their parents, there are even fewer informal caregivers to shoulder this coming load. That suggests a growing need for more early preparation and formal plans of care for those who want to age in place in the comfort of their own home. Now, this True Freedom nationwide home care plan exists exactly for this developing scenario. It is to keep someone out of a nursing home, to keep someone out of having to be forced out into a strange, stark community with people they don't know. The ideal prospective client now for this are seniors, age 65 and older. That does not mean that you cannot offer this or look at a person who's 40. Some very successful, forward-thinking younger people today do realize that they could use someone else's dollars rather than their own, which is sort of like insurance, isn't it? To pay for care or to pay for risk. So these 65-year-old and older people, by the way, if you want to know, the average age is around 72. I was with a couple last night, though. They're 66 and 64, and they're picking this up. I was there to talk about other things. They're clients of mine for 20 plus years. So people that cannot afford these rising insurance premiums, let me talk to you a bit about rising insurance premiums. People always come to me and say, well, my parents have long-term care insurance, or they can buy long-term care insurance, or what is long-term care insurance? Folks, I've been offering long-term care insurance since 1987. I sold one of the first that was ever created. That came out, could have been at the time, Genworth maybe, or another. There was only one or two companies, but they never priced that product correctly. So they priced it very, very low. And then when they had an onslaught of claims come in, these are fantastic pieces. However, the companies could not afford it. So they had to reband their book of business and raise premiums on practically everyone. So these people that bought these long-term care insurance policies were once paying a low premium. Now they're paying exorbitantly high premiums to keep it in force, and also having that company reduce the benefits, reducing either the monthly payout or reducing how long that plan will stay in force, called the benefit period, or a combination of all of them. So long-term care insurance is a different ball of wax because a person has to medically qualify. You have to financially qualify and medically qualify. If there's something wrong with you, you cannot get long-term care insurance. If you wait until you're 65 to get it, it could cost you $6,000 or $5,000 a year or more. But if you did it when you were 40, no, you did it at the right time. That's how insurance works. Here, it's a little bit different. So they see and hear what's happening within their peer group when someone becomes ill or experiences an injury or emotional stress, expense, and burden, and they do talk. If you work with communities, country clubs, I'm here in Florida, everybody's around the pool. This is all people talk about. What surgery are you having? What did you have done? What's wrong with you? How long are you going to stay here, right? How are you going to afford the rising HOA premiums, costs, and fees? So it's very commonplace for people to share these experiences, and they're asking, what do you do? Well, I have had long-term care insurance. I'm protected. Well, even with long-term care insurance, lots of times you're not. You have to go through the company's underwriter and the company's medical team. So enough about that. But when a senior's ability to care for themselves takes a sudden turn, imagine the comfort they'll feel walking freely through their own home, one in which perhaps you helped them modify or, made suggestions to get rid of the rugs, for example. Even if a home care worker has to help them fix a snack or use the bathroom, a senior loved one can still rest in their own bed or on their own couch. Good for them. Seniors who move to an assisted living facility feel as though they've lost their independence. It's a terrible thing. The next thing they feel is that they're going to lose the keys to the car. Now, living at home gives seniors this true freedom, which builds their confidence, promotes well-being, and healing. So whether the family lives 10 minutes away or on the other side of the country, it's impossible not to worry about a senior loved one who may suddenly need home care assistance. This plan or proper planning provides peace of mind, knowing that a procedure is already in place that will arrange for the one-on-one personalized care that a sole caregiver cannot realistically offer full-time. This valuable addition to a senior's future care strategy will grant family members priceless respite opportunities that reduce stress levels and help prevent caregiver burnout. Now, burnout is becoming more and more real for many families as the baby boomer generation ages. I just mentioned my situation. Do you think I could care for my 101-year-old mother? Medicine and technology have become so advanced that many people are living well into their 90s or 100s. In previous decades, elderly people passed away earlier, so caregiving for a loved one at home was required for a significantly shorter period than today. This is becoming a lifestyle, folks. I don't know if you really realize it or see it, maybe you do, but these communities and facilities are making fortune popping up on every street corner there is where CVS was. Now, every family needs to be prepared before this sudden change in an aging loved one's health that can turn everyone's world upside down in an instant. With that said, it is very common for us to talk to the children of the family because they are the ones that really may get it. The older people may be in denial, perhaps, and feel, look, I live to 85, something happens, my kids will take care of it. I'm not going to worry about it. Same thing with an estate plan, or anything. I'm not going to leave anything. I'm going to just, I've done enough for them their whole life, right? But children see it differently. When I say children, 50-year-old children, 50, 60-year-old children, 70-year-old children like myself, right, see it differently. I would gladly, and have, by the way, pay $95 or more than that even to make sure that someone, and not me, can take care of my loved one. So it is a anxiety reliever for the family, and also the individual. It can eliminate this anxiousness. And like I said earlier, the senior people, when they start declining, they have more fears. They become more agitated. It is more difficult to talk to them personally, right? So we want to make sure that there's a way for either them or their family can make just one phone call to a facility and a company that will take over from that point. Now, home care allows loved ones a choice. It allows to serve a critical role in the healthcare system by allowing patients more opportunity to make decisions about their own care. It's very difficult in most cases to move out of a facility once a person has moved in. Has anyone on here tried to move someone into a facility? I have, and supplying all the furniture and all the items, right? Well, then trying to move it out again, it's very, very difficult. So choosing home care, while it's a viable option, is probably the better way to keep options open for as long as possible. And the studies, as we said earlier, seniors also recover faster under home care services than being in a facility. The speedy recovery stems from being in a familiar, stress-free environment and being around their own families, as we said earlier. Also eliminating the risk of infection from exposure to germs. Think COVID that are abundant in medical facilities. So staying home will reduce that. Hospital readmission numbers of patients under home care are small. People can take better care of themselves. Now, the True Freedom Nationwide Care Plan is the only long-term care alternative. And I say long-term care alternative because it is not long-term care insurance, nor can it be said that it is. And the price, and this is really why you're here today, it's really what brought you in, is the price to engage with this coverage will go down by 10% a year for up to first 4 years whenever home care service have not been utilized. So think about that. It's almost like a free an accident-free discount for an automobile, right? Where if you don't have an accident for 4 or 5 years, your premium goes down. Well, the same thing happens here, that while it can start at $95 a month to buy hours, and we'll talk about that coming up soon, the rates will be reduced 10% a year for the first 4 years if there has been no call for care service. And they will remain at that 40% discounted rate, actually 55% for couples who pay annually. So we always try to get the couples to pay it annually, 2 enrollees. And if they pay annually, that's a larger discount. It's a 15% discount for the plan that they access. Now let's talk about the company itself. The company started in 2008. I personally know the owners of the company, the founders, and some of their support staff. I've been representing this for about 7 or 8 years. So my agency does employ agents, real estate agents, insurance agents. How does all of this work? No need to continue talking about why it's important. Let's talk about what it offers, sort of how it works. There's more to it than you'll see today, but this is really the basics of it. The person buys advanced hours. They buy lifetime hours in advance. They cannot need it today. We have what we call field underwriters. That's me, that's you, who get to learn who these people are and make a decision. The company rests on us to make that decision for them and become their underwriter and say, I looked at them, I know them, I spoke with them, I trust them. They do not need care today or will not be needing care tomorrow, but they will be needing care down the road. We know that. We already can prove that. And something can happen in an instant that will require care. So they do have the option to purchase lifetime hours. Okay, these lifetime hours are segmented into blocks. And the first plan is a bronze plan. It's one of the most popular plans people choose. It is $95 a month, and it is discounted 10% a year for 4 years. And it is discounted if they pay annual. And it's even further discounted by 5% if they have a partner also enrolled. So it's extremely affordable. It is one of the most popular. The second one is the silver plan. The silver plan offers a lifetime home care aid hours. These are certified, board certified, or certified agencies with professional aides that will supply care. And you can purchase, and the client does purchase in advance, 3,000 lifetime hours. And that is $175 a month. These are the 2 most popular plans, 95 and 175, especially with the 10% discounts that bring that price down, 95 to 45 a month, and it stays that way. It's a fantastic deal. There's also a gold plan, 6,000 lifetime hours. It's $295 a month. And then there's a platinum plan, which is 10,000 lifetime hours, $475 a month. Don't forget the discounts. Don't forget the discount annually for the first 4 years. It still is a tremendous value for them. So it is safer at home. This is the only nationwide home care option that seniors have. It is the leading alternative to having any kind of long-term care insurance. Membership plans for services can run up to $400,000. I'll explain what that means. Usually when a person wants to have money supplied for long-term care or any care event, they usually buy a pot of money, right? And that pot of money is something that long-term care insurance would provide. Somebody would buy long-term care insurance policy or health or some type of policy that they're buying a pot of money, in this case, $400,000. So this can still equal $400,000 of money to be used for their care for a fraction of the cost. Now, there's no age limits. There's no medical underwriting. Let's talk about age limits. Person can be 90, 95, or even 100, as long as they look likely like they're fine and they're not going to like have Alzheimer's next month, or they don't have a severe medical condition that they know an aid needs to be called in, they qualify. There is no medical underwriting. There is no doctor reports. There is no prescription checks. There is no driver check. There is nothing. So it is easy to obtain. They do start at $95 a month. You get paid a very attractive commission plus renewal. This will avoid a nursing home confinement, or at least delay one. That delay is very important. Why? Because it gives the family the time they need to do the proper research and the proper financial investigation on how that should be taking place. It is cost effective, as I said, and it does provide tremendous peace of mind. They should be protecting their family from a future hardship. And it even could be you. You could protect yourself from a future hardship. Don't always think that you're exempt. You are not, nor am I. This discount is up to 55% if this plan is not used. So there you go. They have it. It's in their pocket. It's in their drawer. They know they have it. They don't necessarily need it. They may need it, but maybe they'll call their daughter and say, hey, if you can do this, if you can help me, let's not use this plan, because the more I don't use this plan, the better the financial cost will be. So people don't always jump into using the plan right away. Again, private care in the comfort of your home, but most importantly here, these people must be able to live independently. Otherwise, we cannot offer it to them. If we feel, as I said again, the only exclusion is not age, it's not even illness. They can have cancer. That's not an issue. The only issue is, do they have one foot on a banana peel? Now, for you people thinking, and I'm hoping that some of you have some stimulation going on where you're thinking, how can I market this? Well, I could tell you that I've done this myself and it works. I've used communities. I went into MLS. I Googled communities. I got their email addresses. I got their regular direct mail addresses. I created a card that looks like this. That barcode is a video. It's not the video you saw. It's a video that you can have access to. It's branded to you once you do your first enrollment with a client. So here's one example. You could create a card that looks something like this. If you're interested, I can help you do it and show you how I did it and get it mailed out. You will get phone calls. You will do business. You will get in the house. You will be able to talk to them about what it is you really do, right? Here's another card that it was created, maybe a little wordy, but it did get their attention. On the top of the card, I changed it. One of them said Century Village residents. So it was really given out to about 3,000 community, residents. Now, I can tell you where the business is. These HOA associations, they claim to do a lot for their $800 a month HOA fees, but they don't do anything like this. There needs to be someone who wants to break into that community field and provide this level of education for the members of this community, this retirement community, 55 and older. Come in there, do a joint case, bring another realtor in. We could do a Zoom. We could do a web presentation, which we have, where you can call me in and I could help you. So there's lots of ways we could work on this through working together. Here's another ad that I created several years back, more of a social media type of an ad, where click here to attend. And I did get people to attend. Now, they bought, but some of them now have become financial clients for me. Those are the people that would become real estate clients for you. I say that only because these people, to me, my core business is not real estate, but I do know real estate. And I have sold real estate and still will, but I understand that the way to get in the door cannot always be, here's my card. The next time you know someone, send me a referral. Here's my card. It just doesn't work. We need to attack and attract people through things in their life that mean something to them, that are meaningful and impactful. Here's a flyer that was created. This must have been created 6 years ago. Maybe some of you saw it. I'm not sure. It was on EXP. I got a lot of interest from agents that want to do this. This was prior to COVID. And so I prepared this as a flyer, and it's something that you could print out and you could create it. You could go to a community. Some people ask, can we go to an assisted living facility? Those people are already in assisted living. You can go to independent living. That's different. Those people do not require care. They're independent living. They're regular people. Or you can promote this to the children of the people of the skilled nursing facilities. Those children could use something like this for themselves because they realize what they just had to go through. So this is a bad picture. I grant you that. It is a video that's available that you will get. once you become enrolled with us. This really does explain in a cartoon fashion. They do a great job. It's been around for a very long time. And you get that. Now, what more do you get? As if that wasn't enough. Commissions. It pays very attractive. It pays an immediate 40% of the plan cost. Figure it out. You have 95 a month. You have 145 a month. You have 275, whatever it is. Multiply it by 12 times 40%. Or if it's a discounted plan, you'll get 40% of the discount if there's 2 enrollees or they pay annual. You'll also receive a 5% lifetime renewal. Now, I use the word lifetime because it is lifetime. Why? People do not stop paying this. In long-term care insurance, you should know this, that people don't stop paying their long-term care insurance policy. I have seen them continue to pay massive increases, but they don't want to stop paying it. It's like, it's one of the highest retention insurance plans there is. Auto, completely different. Life insurance lapse rate could be 10%, right? Under 10 or around 10. Long-term care, very low lapse, very low, because people keep these. They don't want to make that dumb mistake and let it go. This provides you with further recognition, branding for yourself in a way that no one else in this industry is doing. You become the in-home care authority. This puts you in a place of authority. They're looking to you for solutions. You could bring in all the other solutions you provide. You'll be referred. You'll be referred to their children. You'll be referred to their neighbors. Those people will get to know what you do. And oh, by the way, I'm a professional in the real estate industry. I can manage that for you as well. I talked about community development. If you have the ability to get out there and want to work in front of a group, you'll get, out of 20, 25 people, you get 5 or 10 to raise their hand and say, I need this, I like it, tell me more. You'll be able to identify their property needs for themselves and their families. It's a natural way in the door, the best place you can be. And this is true for me as well. On the financial side is getting in the house. If I am in the house, I do my best work. If you are in the house, you will do your best work, right? Aren't we all trying to get inside that house?
Well, that ends our presentation. We hope that you enjoyed it and learned a lot. If you'd like to get started or would like to have a discussion about how to blend this into your practice, call me. The number is 561-459-0222. Or you can email me. You see that right up on the screen. And I'd be very happy to spend some time with you personally. Thanks again.